Please understand that this is a general discussion, and there may be some specific features of specific surgical procedures that might result in different recommendations. Please view this video only as an enhancement, not a replacement for other conversations. My philosophy continues to be, if you are worried, I'm worried. If you have questions or concerns, I would much rather you call the office or submit our question through our website. After your surgery, you will have either a soft dressing or a plaster splint placed. If you are in a splint, it should stay on until I see you in the office for follow-up. If you are in a soft dressing only, you may remove it on the third postoperative day. You will be either toe touch weight bearing, which means that you may put your foot down for balance, but should try to minimize the weight you are actually putting through the injured leg, or fully weight bearing as much as you can tolerate. I will let you and your family know. After some lower extremity operations, I will place a knee brace on. I will give instructions to you to let you know the details of how the brace should be used. We will give you crutches or a walker because I do want you to have as much mobility as possible. Depending upon your injury, we can also work with you to get a wheelchair or knee scooter as needed. Okay, let's talk about bathing, of which I'm a big fan generally. If you are in a soft dressing, you may remove the dressing on the third postoperative day, and as long as the incision is not draining, you may get it wet in the shower. Please do not immerse the incision in water in a bath, hot tub, or pool. You may replace the dressing with a clean gauze or Band-Aids. I would prefer you not to use Neosporin or other ointments. You may, however, paint the incision with betadine peroxide for an antibacterial effect. Sometimes the dressing will be changed in the hospital and a dressing will be placed that is not meant to be changed but can get wet. If you are in a plaster splint, the splint is not designed to get wet, and we want the incision to have some time to heal and rest. You can bird bath around the splinted area, or many patients find that wrapping the splint with saran wrap and then also using a rubber band at the top and bottom can work well, better than the old garbage bag approach. Even with the saran wrap technique, however, you do not want to immerse the limb in water or have shower spray directly on the area. There is a huge variation in pain levels after surgery, but surgery of all kinds does hurt. A good technique is to alternate ibuprofen with the prescribed pain medicine. As long as you do not have an allergy, sensitivity, or other medical reason not to take ibuprofen, adults can take 600 to 800 milligrams, 3 to 4 tablets, and then 4 hours later, take 1 to 2 tablets of the pain medicine. 4 hours after that, take the ibuprofen again, and then you keep alternating. This has proven very successful for patients. Remember, the first 2 to 3 days after surgery are generally the worst with pain. The next phase often lasts up to about 2 weeks, and then things usually get better from there. Almost all of the prescribed pain medicine, Percocet, Vicodin, Tylenol number 3, Norco, have Tylenol built into the pill. Please do not take extra Tylenol in addition to these pills. Also, do not take more pills than prescribed. This can be extremely dangerous for you. One important thing to discuss is the small but real risk of blood clots. To reduce the risk of blood clots, I used a squeezing device on your uninjured leg during surgery. The regular graduated compression helps release substances from the blood vessels to reduce clot risk. After surgery, if you do not have some risk factor that puts you at higher risk, I recommend an aspirin twice daily. Either the 325 milligram or the 81 milligram dose is fine. If you have a personal history of a deep blood clot, a history of a blood clot in your lung, a family history of blood clots, a recent history of cancer, are pregnant, or are on birth controls, we might decide to use a different medication. The number one sign of a blood clot is no sign at all, and the second most common sign is one leg being more swollen than the other, which isn't very useful when we have just done surgery on one leg. So any unusual symptoms of significant leg swelling or cramping are worth a call to the office. We very well may recommend that you have an ultrasound to be sure you do not actually have a blood clot. If you develop sudden shortness of breath after surgery, please call the office, but also go directly to the emergency room. A couple of final points. First, I do not generally have patients start physical therapy for the first several weeks after surgery. As long as you are making good progress, I have not found substantive benefit in starting early. Many of my patients ultimately choose not to go to therapy at all and simply work on things on their own. If you feel strongly, that is fine. We will give you a prescription at your follow-up appointment. Note that some insurance plans require authorization, and that some plans can take quite some time before therapy is actually approved. This video is not meant to be exhaustive. It is normal and expected that other questions can and will arise. My goal, and the goal of OrthoArizona, is to get you back doing the things that you need to do and the things you like to do as quickly as possible and as safely as possible. I honestly wish I could guarantee every patient a perfect outcome, but as I have likely told you in the office, I have not yet been made all-knowing and all-powerful. I look forward to seeing you in the office and follow-up. Again, if you have any concerns, I want to know.